your station of choice.
All right. We do this each and every Saturday. We got to talk to Dr. Bhagat, and this is the Broken Surrey segment where we get to tackle on lifestyle sicknesses, if I may say so myself. Otherwise, on the line with me, morning, Doctor.
Morning. How's you?
Well, I hope you're good too.
We're just now waiting for the rain, huh?
You can say that again.
I tell you, it just seems to be global cooling and warming everywhere. We just hope that we get a little bit of a shower, but it's been very hot, so everybody take care out there in the heat. You know, we'll talk maybe in a couple of series' time on heat stroke, because it's something that we do have in our summer days. But today,
yes, we need to do that.
Let's talk about something that people have been asking me about, and the first I wanted to thank everybody that is listening. Clearly, we have a growing listenership because we're getting hordes of questions on the Heart Foundation Facebook site. So keep them coming in. We are looking at them. We're looking at all the questions people are asking, the topics they're suggesting, and we're writing them down, and we have a huge list. So we're going through them based on number of hits and number of likes in terms of what they want to hear. It is a Heart Foundation Facebook page, but you can ask any question you like and just say you're asking from the Broken Body series on RB2. And something that has been coming up amongst a lot of our listeners is wanting us to talk about not chest pain, you know me, joint pain. We're going to talk about joint pain. It's a very common condition that seems to affect a lot of people, generally of all ages, and, you know, it's something that happens. I'm sure you've had joint pains from sprains and strains and sort of things you've had in your life. Which part of your body gives you the most discomfort?
In terms of joint pains, obviously my knees, and I don't know if this can count as joint pains, but my lower back.
Absolutely, well spoken. Lower back pain is probably one of the most common conditions that takes a patient to a hospital or clinic or a doctor. And the reason for that one, before I even launch into the whole topic of pain, is because sitting is the new smoking, if you like. Sitting is the new cancer. We are just sitting the whole day. And as animals, which we still are, we're designed to move about and to basically stand most of the time. And if you sit, you're putting all that pressure on your lower spine. And, in your 20s and 30s, that cartilage between your bones in the lower spine really begins to give way. And then you start getting compression of your cartilage, and you start getting this chronic lower back pain, which sort of it's more like an ache. And then it goes down your bum, and as you get older, it goes into your legs and then causes issues. And it is something that people take a lot of painkillers for, which we'll talk about in a minute. But absolutely, it does do that. And the same with the knee pain. It's just that we're not on our feet. We're not mobile. We sit and we eat. We sit and we read. We sit and we work. We sit and we, drive. We sit and we watch television. So, we're a sitting culture, and really we're not supposed to do that. That is the major issue in terms of back pain. But just basically going back to basic anatomy, the joints are places where, if you like, two bones meet. They're surrounded by a cover, which we call a capsule of tissue that contains liquid or lubrication, if you like. We call it synovial fluid, and cartilage. Cartilage is sort of slippery tissue that helps to cushion the bones and reduces friction. Now, many causes of joint pain, and I want to tackle them for all the listeners. So some of them clearly are young and others are elderly. So it's a broad brush approach for those that are listening out there on today's topic. So the most common one is arthritis. This is a general term of inflammation of the joints. And there are many different types of arthritis, including age-related osteoarthritis. There's gout-related arthritis from what you eat. There's rheumatoid arthritis, which is a condition that affects younger people where the body, for reasons we are still not certain, begins to attack itself and it attacks the joints. And the joints become deformed at a young age. All treatable and manageable if caught early. So this is the purpose of today's talk. And of course, in young people that are listening out there, injuries is a common cause of problems to the joints, such as sprains and strains and fractures, if you like. And this can also cause pain. And then, of course, infections. If you're diabetic, you may have infection in your joint because you've not realized that your joint has been infected, because sometimes diabetics lose sensation in their feet, and we have septic arthritis, which means infection in the joints, which is a very serious condition. And of course, there are other rare conditions that can cause that tick bite fever. If you go out in the bush and you get bitten by a tick, that can actually go into your joints and cause terrible pain for a long-term issue. So when you have lower back issues, what sort of pain do you get?
It's just, I don't know how I can explain them, but it's just in the middle of sort of like the last part of my spinal cord.
Yeah,
down there. The pain is just
nail on the head.
I don't know how to say it, but it's just painful, honestly.
Yeah,
it's aching more than anything.
That's you're talking about your cartilage, which is separating the last two bones there, and the pain may be, it may be mild, it may be severe, it may be constant, it may be intermittent. Occasionally, it may become red and tender if it's a knee or an ankle, and in the elderly, particularly, it becomes stiff, making it difficult for them to move, which unfortunately with the elderly makes them move even less and makes it even more stiff. So some of the pains in the elderly, we actually encourage them to say, look, no pain, no gain. You've got to move around, otherwise those joints are going to get stiff. Because they'll keep saying, marapo atuba, and we'll have to say move, and they don't want to move. And of course, you get a reduced range of motion in your back. You can't, you can't bend over. In your knees, you can't bend your knees, and the range of motion may be reduced, making it difficult to perform certain movements. So this is how we really diagnose it. The doctor will typically ask you your history and perform a basic physical examination, and in some cases do simple tests like X-rays. And if it's really bad, like at the back, where you're pinching a nerve, we'll do some MRI scans, sophisticated tests. And how do you treat your back pain?
Honestly, I do stretches. That's it.
I think that's the best thing you can do. That's physical therapy, and it can help to improve a whole range of motion and strengthen the affected joints. And I really encourage all people out there who are having these pains. The first protocol is physical therapy. Learn from a physiotherapist or from your doctor or from a sports therapist exactly what to do in terms of stretching, in terms of mobilizing that joint. It's much better than some of the over-the-counter pain relievers, which is something I have a big issue about, because these painkillers are used like Smarties. The one that I particularly have a dislike for is ibuprofen or Brufen. These are toxic compounds that used on a regular basis, and particularly the elderly use them honestly like sweets. They do relieve pain, but they cause a host of other issues, stomach issues, kidney issues, blood pressure issues, bleeding from the gut, high blood pressure, blocks your kidneys, results in kidney failure. So please use these, they're called anti-inflammatories. Use them with caution. And they're all the same, the drug companies will come out with a new one saying this is safer for your stomach, this is better for your kidneys. It's all a load of bollocks. They're all the same medications. They're all packaged in fancy new packages, but they all do the same thing, and they work the same way. They all relieve pain, but they come with a cost, so use them sparingly. Some people can use paracetamol. There's a big debate going on as to whether paracetamol or Panado really works or not, but if it works, it may be in your mind, but if it works, it's much safer for you to take a regular dose of paracetamol or Panado than to use some of these pain relievers like Genpain and Alcoxia and Celebrex, and people will know them out there, Grandpa, aspirin, Brufen. Really use them with caution. And of course, if the pain really is bad, the doctor may actually inject some steroids into your joint, which can help the pain, but again, steroids really should have and do have a bad name because they are not good in many ways. They can relieve the pain, but steroids can thin the tissues, and generally bone specialists don't give more than 1 or 2 injections into a joint ever, because evidence shows that if you keep injecting these joints, you can actually ruin the joint whilst relieving the pain. And of course, in those that have really bad issues, whether it's the elderly or the young, surgery can be recommended for some people who have severe joint pain to do that. And I started getting some questions. I'm just going to answer one question. You can jump in with anything that you have. Somebody's asked you, I have pain all the time, and what can people do themselves to manage the joint pain? Well, we've talked about some of these, and I think there are a number of things that people can do to help themselves manage joint pain. And I think that these include exercise, which is really important for people with joint pain. It helps strengthen the muscles around the joints, improves motion, and you can choose the exercises that are low impact and don't put too much stress on your joints. Ask your doctor or your physiotherapist. And one of the things that is really important, particularly with the elderly, is to keep yourself slim. We have a culture where as we get older and we have these go-go's around, they say, no, I can't look like a skinny granny. I need to be heavy. That's going to punish your joints. So weight loss, if you're overweight or obese, can help reduce stress on the joints. Really, really important. Difficult to do, but it's really important. And of course, some people ask about heat and ice. these can be used to relieve the pain and inflammation in the joints. Both heat and ice work, and your physiotherapist will choose which one is better for you. And of course, it's important to rest the joint. If you're an athlete and you've got pain, listen to your body, otherwise your body's going to punish you. So that's really important to understand. I've got lots of questions coming in, but I'll pause there for your questions if you have any.
For now, Doc, let's just hear what the people have to say.
Okay. I've got a question here which I guess people are asking, saying that, is joint pain ever related to COVID? Yes, the COVID, with COVID, the muscle and joint pains people experience typically occur with long COVID. Long COVID is after the COVID is gone, people may get, considerable joint pains all over the system. Upwards of 10% of people experience long COVID, which is the after effect of COVID, and some of them report muscle, joint aches and pains. And somebody's asked here, what can a virus cause joint pain? Well, COVID is a virus, but yes, many different viruses can cause viral arthritis. Everybody remembers when somebody has flu, the joints and the muscles all ache, and you're coming down with flu. So the virus actually got into your system. So that's important. Somebody's asked you, what can I lubricate my joints naturally with? To lubricate naturally, warm up, drink lots of water, stretch regularly, like you said, strength train, give a little tender loving care to your joints, lose weight. Those are natural lubricants that can work. Somebody's asked you a good question, which I love, and that is turmeric good for joint pain relief? Absolutely. Turmeric is the main active component of something called curcumin. For those who don't know what turmeric is, it's the curry powder, the yellow stuff we use to make things curry-like, and it gives, it's a spice, yellow in color, very cheap, and it has powerful anti-inflammatory effects. Does not cause stomach issues or joint or kidney issues or blood pressure issues, and it has been shown to reduce pain on a regular basis. Mix it with some water or in your tea or in your coffee. Half a teaspoon daily will really work wonders. It's really very, very important. Somebody's asked, is paracetamol good for joints? It can be an effective pain reliever, although the debate is out whether it's actually really just a placebo effect. But that's important. There's lots of questions coming in here. What diseases cause fatigue and joint pain? Well, infections, influenza, some vaccines, after the COVID vaccine, some of us got joint pains, reactive arthritis to tick bite fever, infection in your joint as a result of diabetes, etc. Those are important issues. Somebody's asked the very question you asked, what causes back and knee pain? The biggest issue is weight, sitting, and lack of mobility. So those are important things. Somebody's asked you what antibiotics are used for arthritis. We do use some antibiotics very, very rarely. We use them only when we know there's an infection, or perhaps it's a tick bite, or perhaps it's a spider bite. We know that we need to give an antibiotic. Otherwise, antibiotics are not generally used for that. One more question here. What can I drink for my joints? Well, teas. Tea is one of the best beverages when it comes to benefits of arthritis. The green teas can help. Curcumin or turmeric tea can help. Coffee has proven antioxidants in it. They can help as well. So those are important things here. One more question before I stop and ask you again if you have any questions. Somebody's asked you, is ginger good for joint pain? Absolutely. Ginger also reduces the activity of several chemical substances that promote joint inflammation. So you can have ginger patches. The Chinese are famous for putting ginger patches over knees, and that anti-inflammation can go into your knees and help it. Ginger tea can help both your stomach and your joint pain. So those are really natural ways to help it as well. Do you have any questions? I've got one or two more questions here if you don't have any.
I think one question that I may want to ask, it's about, I hear that people are busy asking about the teas that can prevent or rather easy up the process of joint pains. I would want to know, okay, first and foremost, how then do we prevent it? We get the fact that there are ways of healing, but before we even get to the joint pains, before we even get to any pains, how then do I say, okay, I haven't gotten to having these joint pains. How can I actually prevent myself from having these pains?
That's an excellent question. It looks like you're definitely the proper host for this show. Prevention is better than cure. And to me, as to those youngsters that don't have pain yet at the moment and don't know what we're talking about, It's mobility. It's getting exercise on a regular basis, a bit of cardio, a bit of resistance or weight training, keeping yourself slim, avoiding things that can cause arthritic pain, like too much red meat, too much artificial fats, like sunflower, canola, safflower. These are inflammatory oils that can inflame the joints. Making sure that your weight is under control, making sure that you're eating good portion of veggies, and particularly veggies that contain anti-inflammatories. Small berries like blueberries, raspberries, cranberries got powerful anti-inflammatory antioxidants. Ginger teas, turmeric teas, green teas, all these are much better for you than having dose yourself with these energy drinks, etc. So, and mobility, because most of us are sitting culture in terms of our work. We spend hours in front of the computer or in the radio station, hours on a stool looking at all your displays. It really gets to your back. So move on a regular basis. Get up every hour and just move around, stretch, do some lunges in the studio or in your workspace. It doesn't really matter. Go up and down the steps. Choose the steps rather than the lift. Park your car as far away from the supermarket as possible, so you walk into the supermarket, not as close to the supermarket as possible. So simple ways you can do. I call them kitchen workouts. You don't have to say, I don't have any time to exercise. There are lots of time to exercise, just you don't want to do it. So I think exercise is the key to prevention a lot of joint issues that we see later in life.
All right. I think we should finish with the other two questions, and then we can finish up.
Okay. Somebody's asked here, what is the homemade drink for joint pain? And you've talked about it already. What I do is I put a mixture of lemon and turmeric into some water, warm it up, and I take that on a regular basis, and it really helps. Somebody's asked, can you eat raw ginger? Yes, you can, but it's pretty powerful. So mix it in some warm water. One more question that's coming just now is. Oh gosh, that's a long question. I think I'll avoid that one. Let me talk about this one here. What painkillers are good for joint pain? You can use anti-inflammatories. We talked about them. Brufen and all their cousins are useful, but be cautious about using them on a regular basis, because that really will wreak havoc on the rest of your system. I think I'm going to stop there because they just keep coming in. But thanks for everybody that's sending in these messages, and we'll try and answer them on our Facebook site. Next week, we're going to be talking about something completely different, which has also been a favorite question of ours, and that is kidney disease. People are really afraid of why people have kidney disease, and they'll say, how do you know it's your kidney disease? What is kidney disease? Who gets it? What are the symptoms? Can we prevent it? Is it something that causes death? That's the topic for next week.
All right. Thank you so much, Doc. And we hope that you get to answer all of the questions that are coming in, and we'll meet again next week, Saturday.
See you next week. Take care.
Right. Bye. 10:47 is the time on our station of choice. That was Dr. Bhagat giving us the Broken Series segment. Comes in every Saturday from 10:30 up to now. For now, we do continue with the music.